So preimplantation genetic diagnosis is a technology that permits assessment, chromosomal assessment of the embryo prior to transfer. Candidates for PGD or preimplantation genetic diagnosis are patients or couples who have had recurrent pregnancy loss that is believed to be chromosomally related, or are not succeeding with technologies and need more information about their embryos, or really any IVF patient who wants to do a single embryo transfer, lower the risk of miscarriage, raise the chances of implantation, and lower the risk of Down syndrome. The process starts by placing the day 5 or day 6 embryo underneath a laser microscope such that a few cells, typically about 5 cells, of the outer layer of the embryo can be accessed, and these cells would normally be part of the placenta. The embryo is promptly frozen in a process called vitrification, and the cells that have been biopsied are sent to a specialty lab, a lab that specializes in embryonic DNA testing. About 7 days later, we'll get a report from the lab that will tell us, do we have 23 pairs of chromosomes? If we have a chromosome extra, it's called a trisomy, and that is a very high risk for miscarriage or Down syndrome, so we would not transfer that embryo. If there is a missing chromosome, that's called a monosomy, and those are usually related to failed implantation and do not qualify for transfer either. But if we have an embryo that has 23 pairs of chromosomes, perfectly balanced, then that's an embryo that we're going to transfer. And what we will see is our highest pregnancy rate, very comparable to the pregnancy rates we see for our youngest IVF patients. And this tells us that PGD is able to identify the age factor, exclude it, and give patients the opportunity for a very strong IVF pregnancy potential. Because we're only working with 5 cells, the diagnostic rate is not 100%, it's about 98%, and the patient is encouraged to pursue non-invasive prenatal testing if she's pregnant, and even if necessary, invasive testing to obtain a final genetic diagnosis on the fetus. PGD is great technology. It's associated with very high pregnancy rates once we find a chromosomally normal embryo. It can be utilized for identifying a single gene disorder for a couple if both of them have already been identified to have a single gene disorder and they each have been tested to make sure that we have a test that works on their embryos. Overall, PGD absolutely lowers genetic risk, but there is no genetic test that actually eliminates genetic risk.